Hey, this is Brian again, and I'd like to ask you to do a favor. We can't do this work without people like you, so if you can, please like, share, subscribe, tell your friends about Bring Back The Porch.
You'll see pharmacy technicians. Now, they're a regulated member of the pharmacy team. I believe they need a diploma program. It's usually like a 2-year program. Actually, Medicine Hat College just recently started their program. Hopefully we can get somebody on here to talk more about that. And what their main roles are would be, one, the technical check. So they're comparing the bottles that's in the prescription to, what was actually written by the prescriber. Is this the right medication at the right dose, at the right directions? Does it all make sense? The technical check. Yeah.
This episode of Bring Back the Porch brought to you by Bernie Leahy, River Street Realty. Let's get you home. Well, March is Pharmacy Appreciation Month in Canada. And what better way to celebrate than to have a local pharmacist, Ethan Swanson, come in for a visit on the porch. Welcome, Ethan.
Hey, guys. Glad to be here. Thank you.
Yeah, I'm glad that you reached out to us and said we could talk to you about a pharmacist, because there's probably a lot of people don't really know what's involved. All we see is the person busy behind the counter doing this or doing that. But you were telling me it was 6 years of education for you before you could actually become a pharmacist.
Yeah, that's correct. All pharmacy programs across Canada now are what they call the PharmD, or the Doctor of Pharmacy program. And you do 2 years of prerequisites, all your basic science and math and English and all those sorts of things. And then once you're in the program, it's 4 years, yeah.
What prompted you to want to be a pharmacist?
Yeah, that's a great question. I remember even back in high school, I worked as a pharmacy assistant at a community pharmacy in Brooks, and I was just really inspired by the pharmacists that I worked with. I really thought the care that they provided was just top notch, and I thought that was so cool. I figured, maybe I could do something like that. And, on other reflection too, I've got a lot of respect for the hard work that our doctors and our nurses do. But I don't think that's for me. So figured I could help in other ways through pharmacy.
Now, we call them pharmacists. I think in Britain they call them
Apothecaries or chemists, druggists, some people might say. Yeah.
And the profession has a long history, going back to the days when they had the mortar and pestle.
That's right.
I think that's even the symbol, isn't it, of the pharmaceutical industry?
There's several symbols, yeah, but that is definitely a prominent one for sure. The other one would be the bowl of Hygeia. If you've ever seen, it's like kind of like a chalice with a snake wrapped around it too. Mm-hmm. There's a couple different symbols, or even if you see the big RX, we always refer that as prescription, but if you were to go back into the Latin of it, it would stand for recipe. Because like you say, back in the day, the doctor would write a list of ingredients, and then we'd go in the back and collect them all and mix it all up to make the medicine for you.
You don't do that anymore, though.
No, absolutely not. Yeah. Funny enough, there's an organization called NAPRA, which sets the regulations and standards for a lot of pharmacy practices, more specifically with compounding medications. Mm-hmm. And you'll find nowadays a lot of community pharmacies, they don't even compound on site anymore. They just don't have the required apparatus to do it, the fume hoods and that sort of thing. So. Okay. Oftentimes it'll be a compounding facility in maybe a bigger center like Calgary, where the community pharmacy in Medicine Hat would send the order, Calgary would make it, and they'd send it down.
Compounding, a term just basically mixing it all together, that's what it means?
Yeah, that's right. And it could be a lot of different formulations and products. So we think of creams, specialty creams, or maybe if somebody has difficulty swallowing a pill or a tablet, it could be compounded into a liquid formulation. And, a lot of times in Canada, we deal with drug shortages, believe it or not, where the specific medication, from the manufacturer just isn't available. They just can't keep up with demand. So then compounding pharmacies would assist by making their own versions of those capsules or tablets.
Okay. When we walk into a pharmacy, we'll see, the people on the counter that are actually handling, the transactions, and then there's another level, and then there's another level. Can you explain all the different roles within that area?
Yeah, absolutely. So when you walk into a community pharmacy, the drugstore, there's usually 3 different types of people you'll find behind the counter. So first, we'd say the pharmacy assistants. So they're unregulated. Some may take a course in school, but it's not a requirement. And they can certainly help you with taking in the prescription, entering in the prescription on the computer to get it all ready to fill. They can grab the bottles and count out the pills, put it in the bottle, that sort of thing. Then the next step, you'll see pharmacy technicians. Now, they're a regulated member of the pharmacy team. I believe they need a diploma program. It's usually like a 2-year program. Actually, Medicine Hat College just recently started their program. Hopefully we can get somebody on here to talk more about that. And what their main roles would be, 1, the technical check. So they're comparing the bottles that's in the prescription to, what was actually written by the prescriber. Is this the right medication at the right dose, at the right directions? Does it all make sense? The technical check, yeah. And then usually the folks in the white coat will be the pharmacist there, and they are doing the clinical check, right? So for every prescription that a doctor writes, be it in the drugstore or in the hospital too, we're always checking, is it indicated? Does it make sense that, this person was prescribed this medication? Is it effective, or do we believe that this particular choice is going to be effective? Is it safe? Looking at their other medical conditions, looking at their lab values, is it safe to proceed with this medication? And then the last part is adherence. Is it realistic that this person will be able to take that medication? Do they have problems swallowing, or they need a different formulation? That kind of thing.
How important is it for myself as someone that brings in a prescription to actually meet the pharmacist, or at least for them to know who I am and what my drug history is?
That is paramount. That is so important. When the pharmacist is talking with the patient, we get so much more, right, than just the drug that's written on the piece of paper and a list of lab values. We really get to understand you and your values and what's important to you, and also being able to set, realistic expectations. On paper, this prescription might make sense, but after talking to you and learning more about what you like, what you don't like, your preferences, we could collaborate with both yourself and with the doctor to change up the treatment plan to make it work best for you.
Would you ever countermand a doctor?
Countermand?
In terms of, okay, I don't think that this is the right medication for Mr. Smith. Would you call the doctor and talk to them and say, have you considered that maybe we might want to use another approach?
Yeah, absolutely. Healthcare, I say it's a team sport. Mm-hmm. And as cringy as it may be, I say teamwork makes the dream work. Mm-hmm. Absolutely. So like I say, anytime a new medication order or prescription is written, I'm checking for that indication, efficacy, safety, and adherence. And if any of those tenets, doesn't line up with the full picture in front of us, then absolutely I'll need to call the doctor to look at other alternatives. And it's always in the best interest of the patient, right?
Okay. The role of a pharmacist has expanded greatly in the last number of years, and I think you were telling me here in Alberta you might have more wider parameters than any of the pharmacists in Canada.
Yeah, that's correct. Yeah. For anybody who's curious out there, you can Google CPHA, so the Canadian Pharmacists Association, and just type in scope of practice. There's this really pretty document that has all these check marks and X's that basically say what a pharmacist can and cannot do in Canada. And pretty exciting. You look at Alberta and it's all check marks. Pretty darn sweet. So arguably, pharmacists have the widest scope of practice here in Alberta compared to Canada and arguably the rest of the world. We can do so many different things, be it prescribing medications, ordering lab values, prescribing in emergencies. We can make therapeutic substitutions. Let's say if a prescription comes in and it needs to be changed, but who knows, maybe it's Christmas Eve and the doctor's office is closed or something like that. We can use our own assessment to change the therapy and make it appropriate for the patient.
Can you also write prescriptions? Yes,
that's right. Now, there are several caveats with that, and I think that's where it's incredibly confusing for patients. Here in Alberta, in order for a pharmacist to write a prescription, they need to do some additional training, to which then it gets approved by the Alberta College of Pharmacy. It's called your APA, your Additional Prescribing Authorization. But for simplest terms, I guess, as a patient, you can always just call the pharmacy and ask, do you have a prescribing pharmacist? And we'll tell you. And the other caveat too, with this additional prescribing authorization, we still cannot prescribe narcotics, cannot prescribe controlled substances like benzodiazepines or an Ativan or stimulants, some ADHD medications, that type of thing.
Okay. If you have someone coming in that doesn't know what they need, how do you diagnose that and then suggest maybe an over-the-counter medication?
Yeah, for sure. There's lots of different acronyms and stuff I remember in school, but basically it's just data gathering first and foremost. So we learn about the patient, your age and what medical conditions you have, what are your symptoms, how long have the symptoms been going on for, have you tried anything already that makes it better or that makes it worse, and then of course looking for red flags and that sort of thing. So if we're not seeing major red flags, you're not bleeding all over the place and having extreme crushing pain or things like that, well then either an over-the-counter medication might suffice, or the pharmacist could potentially prescribe a medication too. But if we see those red flags, then it's just as important for the pharmacist to know when to refer. Hey, I think it's really important that you go see your family doctor, or if it's something urgent, I think you need to go to the hospital.
Now, are you able to access a person's medical records?
Yes.
To check to see what they are on?
Yeah, absolutely. So we're really fortunate here in Alberta. We have a portal called the Alberta Net Care. And it's basically a provincial database for all the patients, lab information, if they've had consults with other providers, that sort of thing. Obviously, first and foremost, we need consent from the patient that they agree to us accessing that information to further help their care. But Alberta's got it really, really dynamite. It's awesome, especially too with the changing with the hospital computer systems. Now all across Alberta, they have this Connect Care, if you've heard of that. And now we're more up to date than we ever have been, especially even from the drugstore side of things. We know what's going on.
There'll be the medical record, but then there's the other things that a patient might be taking from over-the-counter. They might be taking supplements, so it's important for them to let you know exactly what they're consuming so that you can make sure that nothing that you give them to take is going to cause them problems.
100%. Yeah, absolutely agree. And again, with that Alberta Net Care, you're right, natural health products, things like that aren't filled through the computer, they're not going to show up there. So for sure, it's important for the patient to be aware of what they're taking and that sort of thing, so we can get all that data put together to make the right assessment.
And it's not that you're being nosy.
That's
this is
right.
For your health.
Oh, 100%. Yes. I think things have improved over time as people start to realize, the scope of practice of pharmacists and what they can do. But I'm not being nosy to be nosy. I'm just gathering all the data I need to help find the best treatment for you.
And that button that you were wearing, I think, says it all. It says, ask your pharmacist.
That's right.
Yeah, you need to communicate. They're not mind readers. They don't know everything. And, if you could miss a little key thing, it could cause you some issues. So get that one-to-one rapport with your pharmacist. It's very important.
100%.
Let's talk about some of the scenarios that we're seeing now. Like you say, maybe it's Christmas Eve and my doctor is closed and I need a refill on my prescription, but it's out and I won't be able to access them for a couple of days. Can you help me?
Yeah, absolutely. So again, another caveat, I talked about the additional prescribing authorization. That's specifically for like a brand new prescription. You've never had it before. You haven't seen the doctor about it before. So those pharmacists, they have to do this additional training. But besides that, any pharmacist in Alberta licensed to practice can definitely help with extending existing prescriptions. So yeah, it's a holiday and the doctor's office is closed. You're out of your refill for your chronic medication. Absolutely, pharmacists can assist with that. We'll ask you a couple questions. Again, we'll make sure it's working for you and you're not having any major side effects, that sort of thing. And absolutely, we can extend that prescription.
And you can also administer things like flu shots.
Yes, yeah. I wish I had the exact statistics with me, but pharmacists help with a lot of flu shots, COVID shots, RSV, pneumococcal vaccine, shingles vaccine, updating your tetanus, and even some travel vaccines too. If you're going to Mexico and you need a Hep A, Hep B, that sort of thing, talk to your pharmacist first. We can likely help you out.
And you've been taking a lot of pressure, I think, away from emergency rooms and doctors' offices just through your services.
We're certainly trying to do that. Like I say, pharmacists aren't here to replace anybody. I'm not a medical doctor. I'm a doctor of pharmacy. But certainly we're here to help ease the burden, right? If you ever have a concern, with what might be a minor ailment or let's say a bladder infection or something like that, before you go to the walk-in clinic, before you go to the emergency department, you can always call the pharmacy first and see if we can assist. And if we can, that's great. We'll write you a prescription and get you on your way. And if there's some red flags going on, then we can help point you in the right direction.
All right. Anything else you want to touch on, Ethan, that we haven't mentioned during our discussion?
No, I think that's pretty much it. I really appreciate your time, and let's see if we can get somebody from the pharmacy technician program on here too.
That would be important. Medicine at College, another opportunity for people to get education without leaving home. Mm-hmm. Ethan, thank you very much for your visit.
Great, thanks, Brian.
Hey, this is Brian again, and I'd like to ask you to do a favor. We can't do this work without people like you, so if you can, please like, share, subscribe, and tell your friends about Bring Back the Porch.